Hello students, welcome to the class. I am Yogitha. Our subject is nutrition for nurses, and today we are going to discuss about macrominerals. In that we are going to discuss about magnesium. Now, magnesium in human body, it consists nearly 25% of magnesium. Now, what I can say that around 25 gram of magnesium can present in human body. That also around 60% present in the bone. Rest is present in the soft tissue of our body. So, even to make a strong teeth and strong bone, along with the calcium and phosphate, we want magnesium also. Now, the level of magnesium what present in blood is 5 milliequivalent per liter. It's very less, 5 milliequivalent per liter. But the daily requirement of magnesium is in adult 350 mg per day. For healthy adult 350 mg per day, and for the females it is 300 mg per day. Now here the requirement in females, it increased when they are pregnant and in lactation. That will be more than 300 mg per day. Now, from where we will get this magnesium? What are the food which are rich in magnesium? Green leafy vegetables, meat, milk, seafoods, cereals, nuts, beans and fruits. So, these all are the food which are rich in magnesium. Next, what all are the function of magnesium? Magnesium, as how I said, it is really important to form a strong bone and teeth. It also helps act as some coenzymes. Magnesium is essential to maintain the neuromuscular activity. Magnesium is essential to synthesize the protein. Magnesium is also helpful in soft movements of our muscles, as well as maintenance our nerve impulses. To transfer that nerve impulses, we want magnesium. Now, what is the deficiency disorder? In case if you take it in less than the requirement of your body, what happens? Here that include depression, muscular weakness, vertigo, nausea, vomiting, muscular weakness and convulsion. See, these all symptoms can be noticed in adult or any individual who is taking a deficiency or deficit amount of magnesium in their diet. Now, meantime, if you take more excessively, that leads to the toxicity. Now, this toxicity risks are very less, but still, in case if any individual take it in a more quantity, we can notice they are having diarrhea, abdominal cramping. Risk is also increased to kidney failure, as well as a kidney may find difficulty to do its normal routine functioning of work. So this can happen when you take the magnesium in a high quantity, or toxicity will address. Next, the next macro minerals what we are going to discuss is sodium. Okay, now the macro mineral is sodium. Now sodium, it is nearly present 120 mg in our body. Now it is also one of the electrolyte component which helps in to maintain the extracellular fluid balance in our body. The extracellular fluid volume, fluid sodium in our blood in our body is 142 milliequivalent per liter. The normal level of extracellular fluid sodium in body is 142 milliequivalent per liter. Now, what's the sources from where we are getting this sodium in our diet? Now, mainly with the table salt, green leafy vegetables, fruit, egg, meat, fish and dry fruits, dry fishes, seafoods which help us to get sodium. Students also note, whatever we get in a food, it may not be sufficient to meet the sodium requirement of our body. That's the reason we are adding a sodium to our food, table salt. One thing, it also helps to improve the taste of our food, as well as it helps to meet the needed required sodium in our body. Like how much we want, that we can get with the help of table salt. Now, the daily requirement of sodium is It is given that daily minimum 500 mg is required. It depends on the region where you are living, because India we are having a different kind of climate, different environment. Based on that, it also varies, because what food we take, what kind of water we drink, that also influence when you take a sodium in your diet. Now, what happen in case when you take excess of sodium? Definitely, when you take excess of sodium, most of the time that will be excreted out through your urine. Now, here very important problem is sodium imbalance can happen. It's because there is we are finding difficulty to maintain the sodium balance level in our body. See, when we take in excess sodium in a diet, what happen? We get a feeling of feeling thirsty. You might have experienced you had something salty, maybe salt biscuit or some food item which you tasted that is very salty. So immediately after, what happen after some time? You get a stimulation that you are feeling thirsty. Then you tempt to drink water. Now, when you drink water, this water will dissolve the sodium water present in your body, that help you to maintain the balance so that you feel much more comfortable. Well, now, what's a deficiency disorder? Sorry, now before the deficiency disorder, what's the function of sodium? Now, sodium, it is helped to maintain the balance between extracellular and intracellular fluid. Sodium also help to maintain the pH level in our body fluids. Sodium help to maintain the muscle contraction. It also help to keep the individual maintain the nervous function properly so that they behave normally. You also might notice if anybody's sodium value falls down, they are disoriented, they behave something strange. Okay, this can happen. Also, sodium helps to maintain the muscle movements. Very important role in maintaining the heartbeat. So these all are the important function of a sodium. Now, what happen in case if you don't take sodium sufficient in your diet? Now that may lead to a condition called hyponatremia. Hyponatremia is a condition where you find a sodium level is low in your blood. Now here, individual may experience vomiting, diarrhea. It's because of loss of sodium. Now, chronic renal diseases. It's mainly because of poor absorption of sodium, and also chances are there that they will develop Addison disorders. Now, the severe in case of severe hyponatremic condition like severe dehydration, severe decreased blood pressure, severe decreased blood volume, and all the failures, renal failure, cardiac failure, such conditions can be seen. Now, what happens if you take more amount of sodium in your diet? Excessive toxicity. Now, that is called hypernatremia. If you a condition where the sodium level is increased in your body, that is called as what? That is called as hypernatremia. Now here the symptoms are increased retention of water in the body, that means complaints like edema, then increased blood volume, increased blood pressure. See, these things can be seen. Now also it is also related with your hypertension condition. Students, you might have noticed if the patient is suffering with hypertension, increased blood pressure, doctor will advise them not to take salty diet. Advise them salt-free diet. That means when you take salt, that will help to pick your blood pressure. That's the reason to decline that, stabilize that. We are providing a diet which is less with salt. See, this is mainly because sodium has got that function to maintain and stabilize or pick up the blood pressure. So, we are giving a diet which is less in sodium. So, this is all about sodium. Okay, now let us study about this potassium. Potassium is also one of the macro minerals what we want. Now, potassium, it's mainly intracellular fluid. It's a component of intracellular fluid where human body contain almost 250 gram of potassium. Okay, the whole human body contain 250 gram of potassium, whereas the normal level of intracellular fluid of potassium is 155 milliequivalent per liter. 155 milliequivalent per liter, whereas the normal level of extracellular fluid where it is 5 milliequivalent per liter. So this potassium, now this is both intra and extracellular fluid component we can see, but if it is intra, that requires nearly 155 milliequivalent per liter. When it is extra, that is only 5 milliequivalent per liter. Now, what are the rich sources of potassium? The rich sources are cereals, pulses, green leafy vegetable, tender coconut. So drinking tender coconut is really helpful. That help you to get this potassium. Then banana, potato, carrot, tomato, lemon, and animal sources like milk, meat, poultry, fish, and eggs. A very common that we are drinking tender coconuts, one of the very good habit which help you to keep up level of your potassium in your body. Now, what's the daily requirement of potassium? The daily requirement of potassium is exactly not known, but some studies says that we need 2 to 3 gram per day. Exactly, we don't know how much we required, but we want 2 to 3 gram per day. Now, what's the important function of potassium? Now, potassium help you to maintain the balance between this intracellular and extracellular fluid. Potassium help you to maintain the balance of your muscle tone. Potassium required for a pH of fluid balance. Potassium is also facilitate the nerve impulses from neuron to neuron. To send these nerve impulses, we want potassium. Then, potassium is also required for the growth of tissues and maintenance of tissues. Then it is also essential to synthesize the glucogen. Now these all are the important functions why we want potassium in our body. Now what happens in case if you don't eat? Definitely that leads to deficiency disorder. The deficiency of potassium is known as hypokalemia. Students, please note, the deficiency of potassium is known as hypokalemia. Now, hypokalemia, if it is prolonged from a long time, you are not taken potassium in your diet, then there is a chance that may leads to develop some cardiac problems like myocardium and kidney disorders can be arise because you are not taken sufficient amount of potassium in your diet for long time. Now, that may include this hypokalemia symptoms are include like muscular weakness, irritability, paralysis, tachycardia, dilatation of heart muscles as well as gallop rhythm and change in ECG of heart. When we take the ECG, we can see the changes in that ECDPQRST. Yes, as well as gallop rhythm, S1, S2 is normal, S3, S4 can be heard. Now, what happens in case if you eat more? Definitely overconsumption and toxicity. The overconsumption, increased level of potassium in your body, then that condition is known as hyperkalemia. The increased potassium level in your body is known as hyperkalemia. Now, hyperkalemia symptoms include cardiac and central nervous system symptoms like depression. Some heart signs include like bradycardia, low blood pressure, low heart sound, very feeble pulses can be heard. Also, vascular collapse, chances are there. Then finally, that leading to cardiac arrest. See, we are having lot of cardiac related symptoms. Then finally, it may end up with cardiac arrest. Also, some symptoms like weakness, confusion, muscle rigidity, numbness. Along with that, chances are there individual may develop renal failure, severe dehydration or any kind of kidney diseases. Now, these all things happen only when there is excess amount of potassium when we intake. But definitely these complaints are very rare, but still chances are there if you mix match with your diet. So, this is very important about potassium. Deficiency of potassium is called hypokalemia. Excessive overconsumption toxicity of potassium is called hyperkalemia. So now we'll study about chloride. Now chloride is one of the chemical form of this chlorine which present in our body, and chloride is one of the extracellular fluid in our body. Now if you are taking a sufficient amount of sodium, then definitely that help you to meet the need of this chloride. Now, a normal level of intracellular fluid chloride level is 103 microequivalent equivalent per liter. Now, this chloride need is really met when you eat a sufficient amount of salt. That means we are adding extra salt in the diet and we are eating. Now, what all are the important sources that we are getting this chloride? One is common salt, your table salt, what we are using for our food. Then definitely a green leafy vegetable, fish, milk, dry fishes that help us to get. Now, the dietary requirement, it says that 700 mg per day. But if you see Indians, where we are taking nearly 10 to 15 gram of salt, chloride per day. So, definitely, when you consume this sodium, no doubt that we are able to meet the need of this chloride. Now, what's the function of chloride? Chloride helps us to maintain the body fluid balance. It helps us to prevent from dehydration. It helps to maintain the pH level. It helps to maintain the balance between intracellular and extracellular fluid. It also requires to produce that gastric juice, HCl, in your stomach, so that we are able to maintain that pH level. Okay. Now, what happens in case if you don't eat sufficiently in your diet? Now, deficiency of chloride, it's very rare. It will happen only when the individual is having excessive vomiting and loose motion, diarrhea. Only in that case, we can see that someone can develop deficiency of chloride. Now, still, if it is deficiency occur, then that will lead to very low amount of chloride in their bloodstreams, as well as it leads to acidity and imbalance of extracellular fluid level. The balance will be matching. Mismatching can happen between this balance. It's only in case of you're having excessive vomiting and diarrhea. Now, what happens in case if you're consuming more amount of chloride? Now, when you consume more, the condition is called as hyperkalemia. The condition hyperkalemia, that means you are having excessive level of chloride in your blood or in your body fluid. Now, what happens? That leads to acidity in your blood, as well as low blood pressure and a kidney failure. Your kidney may not able to bear that, then definitely you may develop kidney or renal problem when you are having excessive amount of chloride in your diet. So, dear students, I hope you understood. Please go through all together. In MacroMinerals, you need to know the daily requirement, food, function, and what's the deficiency of that particular minerals disorder, and overconsumption and toxicity disorders. I hope you understood. Please go through, keep reading, keep watching, so that I'll meet in the next class with a new concept. Thank you all.